the leg is bent. And also this leg will be bent. So I start with the applying the pressure at the first web space here. We applied that many times, right? But you can also do it on the last web space here. So I may go this way. When you apply the pressure here, it would go dorsiflexion and inversion. When you apply it here, it would go dorsiflexion and eversion.
Is that the last web space?
Mm-hmm. So I prefer this.
So when they're in stage 1 and stage 2, are they gonna be pretty spastic? Like would they be on their forefoot here?
Not necessarily. Okay? Also, I can apply the pinching of the Achilles tendon, and it's going to give me more of a plantar flexion, okay? And dorsiflexion.
Can you repeat that?
The Achilles tendon, more of eversion and dorsiflexion. So the toes, those 4 will be activated first before the big toe. If you apply the pressure here, the big toe will be activated before the 4 toes. So for strokes, you need this first, those first. Okay, because if you remember, inversion is in both energies, right? Okay, so you need eversion more. Okay, applying pressure here could work. I can apply the pressure here over the tendon of the extensor digitorum muscle. So here is the pressure. So, and I do it this way, not this way. Okay. So I told you many points right now, correct? Okay? You can use any of them. The response would be okay. But don't use them if your patient can, from the first day, do this. Your back and neck. Right? These are reflexive movements. So we should only use them if we don't have any voluntary movement. So if my patient can do that, this is a very good sign. If they can do that actively from the first day after stroke, that's great. Can I apply those to a Guillain-Barré syndrome? Can be applied to a lower motor neuron lesion? No more. Reflex arc. So these are dependent on the reflex arc. Right? So for Guillain-Barré syndrome, I have to take the patient in a different position to activate the muscles. So I usually do that in sideline for those people. So gravity is eliminated. Okay? But these can apply it only for an upper motor neuron lesion. All right, so applying pressure here, over here, the Achilles tendon. You're fine. You can do that. Okay? There are more, but I don't want to overwhelm. So only 2 and 2, 4. Okay, so we did that. Stages 2 and 3. So now when I do this pressure, my patient foot would be going up this way. So I would ask my patient, okay, to be attentive to the movement. Feel the response. Feel the movement of your leg. If my patient does also flexion at the hip, I would allow that at the beginning. So that's fine. Okay? So when they feel the response, they start to memorize the movement. Okay? Once they are there, I'm gonna ask her to hold. So holding this means, of course, an voluntary isometric contraction. Okay? So once the foot is up, please hold and let it go. Don't let it go. Okay? So holding it. So now it's a kind of a mix between reflexive and voluntary movement. And this is kind of a transient stage between being reflexive and voluntary. Okay? Once the patient is able to hold, now I got some flexion here. Next will be what? Lower down slowly. So the patient is going to lower it. Okay? And again, doing it again. Lower it, lower it, lower it. When you feel your patient is having good control on them, would start asking my patient to lower it. Hold it here, please. Lower down, hold it, lower it. Okay? You repeat that many times, many sessions. Okay? You got that control good. I would start adding resistance. So lift up. So now my resistance, look at my thumb here. I don't resist this part. I resist the outer side. So this kind of resistance is a stimulus to increase the firing of those everters and toes extensors.
Show me again.
Okay. Here. Okay. Your patient now can do against resistance. What is the next step? Are we done? We need to do that with the knee straight and the other leg straight. Okay? So now I would ask my patient to hold the foot up to the chest. So here you go. If they are able to do this, you're ready to go to stage 4. Now they can overcome spasticity of the calf muscles. Okay? Now stage 4. Patient is sitting. Can stay there. Sitting and doing this movement. Okay. So we're gonna continue doing this movement with them. And also you have to resist this movement. To increase the strength, you have to add resistance. So how can you add resistance here? Manual resistance. So you go down to that level and
Put my foot over it.
or knees. Ankle weights on the toes, right? And usually these ankle weights are keep sliding and falling, right?
Correct.
Yes. So what else?
Elastic band.
Elastic band. How to apply it? You're gonna go down and hold it again.
You would have the patient step on it with the other foot.
Step on the other foot. Okay? Yeah. Make a loop and have it on the other side. Right. So to do it, medial or lateral?
Medial to get to go lateral. Force.
Medial to go lateral. Okay. This would be also activating the everters of the foot. So we're always asking the patient to start at the 4 toes and going out. Okay? So elastic band's gonna be good for that. You start yellow and progress. At stage 5. Now they are ready to do it in standing. Okay? But doing it in standing, it has to be against the wall first. Feet are away from the wall, not like this. This is kind of a progression. I'm gonna do it better. But now I'm there. Okay, knees straight now, and then ask my patient to do this movement on the afflicted side. And again, start with the toes. So starting at the toes, all the time, start at the toes. Your verbal cue to your patient, toes first, toes first. As you move the feet back, okay, means more difficulty to the patient. So it's really not easy doing them here, okay? It's easier to be there.
Shoes on, right? Always shoes on.
Yes. It's better to be there. Shoes on.
Could that be kind of considered a weight in sitting? Put the shoes on.
The shoes on, yes. Can be, yes. Okay. So as you go back there, it's kind of less range, okay, and more control. Then I would do that with the patient holding on something on the front of them, like that. Okay, and at stages 6 and 7, we do that without any support. What next?